Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I am a board-certified endocrinologist, meaning that I had special training in hormones, metabolism, diabetes, and thyroid disorder after my residency in medical school. I turned to functional medicine or holistic medicine around 2022 and have never looked back. On this episode, I am bringing you the visionary, the GOAT, the best in stem cells from a cosmetic approach. Dr. Nathan Newman is a visionary in stem cell science, beauty, and healing. He has multiple patents, and he does this procedure called the stem cell lift, where he actually does facelifts without scarring, without cutting, and people do very well. So I brought him on for multiple reasons, but I wanted him to explain to you guys what is a stem cell, because there's still a lot of confusion even after our episode with Dr. Khan. Why are stem cells important? We talk about the different types of stem cells, adult cells versus cord cells versus embryonic, mesenchymal stem cells. He explains all of this. He also explains that adults actually still have stem cells. We know that because of bone marrow transplants. A lot of adults have had bone marrow transplants, but he explains why you don't want to use bone marrow to do a cosmetic procedure with stem cells, and how actually our fat has 500 times more stem cells than our bone marrow. So that was pretty interesting. We had a long discussion about should patients with autoimmune diseases actually use filler. And that's one of the main reasons I brought him on, because I have so many patients that have autoimmune disorders and ask me so many questions about filler. And you can really develop a lot of issues with filler if you have autoimmune disorders. But I understand the vanity and wanting to look your best. So I have Dr. Newman explain what you can do besides fillers. We talked about who should use stem cells, what they can be used for, not only from an aesthetic perspective, which is his specialty, but also the future of stem cells in medicine. So can we use them for joint issues? Can we use them for things like Hashimoto's? And we discussed all of that. We also discussed how we could maybe use them in my clinic for Hashimoto's with thyroid biopsies. Dr. Newman told us how he uses stem cells. And again, he uses them aesthetically, but he does use them to help heal wounds for painful joints. He has this disease that he treats called lichen sclerosis, which is a very debilitating disease of the vaginal tissue. He also talks to me about his new stem skincare line, which is made with plant stem cells. And so he explains that. He explains how it works, why it works, gives us a very, very basic skincare routine. So I was somebody who had 10 or 11 steps that I had to follow for my skincare routine, and he breaks it down to like 3, which is amazing. If you listen to the very end, he also gives our listeners a very special discount code, which was kind of him, and will be in the show notes. And then lastly, we talked about my experience with a procedure that he is doing for me. So when this episode was recorded, I had not had this procedure, but when it comes out, I will have, and where he used stem cells from fat from my own body to fix my under eyes. And so we discussed that and my experience with his skincare line as well. So stay tuned until the very end. This episode is packed full of amazing information with the wonderful Dr. Newman. Welcome to this podcast episode with Dr. Nathan Newman, who is a visionary in stem cell science, beauty, and healing. Dr. Nathan Newman is more than a doctor. He's a pioneer, inventor, and healer dedicated to changing lives through the power of stem cell technology. As a board-certified dermatologist and cosmetic surgeon in Beverly Hills, Dr. Newman is best known for developing the stem cell lift, a groundbreaking, scar-free procedure that restores youthful contours, heals damaged tissue, and rejuvenates the skin naturally, without surgery or artificial fillers. His innovative technique has been used for scar-free facelifts and body sculpting for natural rejuvenation, healing wounds and revising scars that impact self-esteem, regenerating joints and muscles to restore mobility and comfort, helping patients with autoimmune diseases like lichen sclerosis, and reclaiming the quality of their life. Dr. Newman's passion for healing doesn't stop at cosmetic procedures. He's a scientist and researcher holding multiple patents in stem cell technology, regenerative medicine, and medical devices. His cutting-edge research laboratory continues to develop revolutionary stem cell-based treatments, including skincare and hair care solutions that harness the body's own natural ability to repair and renew itself. His latest innovation, STEM Natural Intelligence, is a breakthrough in skincare using his patent plant stem cell derived consortium factors to help skin rejuvenate and thrive, making scientifically advanced skincare accessible to all. Dr. Newman earned his medical degree from Albert Einstein College of Medicine and trained in dermatology at Cook County Hospital in Chicago, followed by an advanced cosmetic surgery training through the American Academy of Cosmetic Surgery. This foundation gave him the skills to develop life-enhancing treatments that go beyond traditional medicine. Thank you for joining me on this episode, Dr. Newman. Welcome back to this week's episode. I'm very excited today to have Dr. Nathan Newman with me. He is like I told you, a board certified plastic surgeon, and he also practices in Beverly Hills. He's kind of the king or the mecca of stem cells. And so he has been using stem cells longer than most people have even thought about them. And so we're going to talk about so many things today, but I'm going to let him start by introducing himself briefly and just telling you how he got into this field and how long he's been working with stem cells.
Hi, everyone. I trained as a dermatologist, and dermatology is skin, hair, nails, and what people don't know, it also includes fat. And we were doing a lot of fat grafting, and we were doing a lot of liposuction, and the results were not very good at the time. And as I did my training and I went to do a fellowship in cosmetic surgery, we started doing better techniques. We started doing closed techniques where we didn't sort of use the fat in a very archaic way. We started updating our processes, and as we were doing that, we found out that stem cells are found in all the tissues in the body, which we didn't know before. And stem cells are the cells that repair and regenerate you. They're the ones that grow your hair, your skin, your nails. Every part of our body, every organ in our body is renewed through stem cells. And there's no organ, there's not even your brain, not your fat, not any part of you is the same that it was 10 years ago. It's all new cells. So once we found out that there are stem cells in the fat, and the fat not only has stem cells, but it has the most amount of stem cells of any tissue in the body, I started playing around with this idea of what happens if we were going to take those stem cells and concentrate them and increase the number of stem cells as we're introducing into the tissues. Are we going to get better results? And that's exactly what happened. We had amazing results. I had a patient who had a cancer in his face that was removed. He had radiation, he had burns, he was in complete agony all the time from the nerve endings being trapped in the scar tissue, and there was no blood flow there. So anytime you would cut it or inject it, it would start to die off. And when he came to me, I said, I can help maybe improve it a little bit. I didn't really realize what the capability of stem cells were at the time. So when he came to me, we injected him. I did it every 3 months for 2 years. So I did 8 treatments on him, but it was amazing. The burn on his skin was gone. The jawline was back. His bone was back. His tissues were there. He didn't have pain anymore. And I became a huge believer in stem cells. And when I was doing this and doing this process of concentrating the stem cells, I was one of like 5 people in the world who were using stem cells from fat to do anything like this. And um, so I had to sort of devise everything and learn everything on my own. And when I saw what happens in the clinic with my patients in the cosmetic world, where their wrinkles went away and their skin starts growing and glowing in like few days, you're like, this is not something the cells are just doing, but something the cells are producing, and they producing a language that is creating all these changes. So that's how I got into stem cells.
So how long ago was that, Dr. Newman?
25 years ago.
Okay. So 25 years ago, you kind of did the traditional, I guess, dermatology route and then plastic surgery. Is that what you did? Or, yeah. And so you were kind of doing the cutting and the facelifts and everything that you typically think about in Beverly Hills. And then you started to realize people actually got better results when you used these stem cells.
Absolutely. What I realized is that when we cut, we're creating scar tissue. We're thinning out the skin. We're taking away the healthy tissues that are feeding the blood vessels that are feeding the tissue, the fat that's there, we're taking it out. We're hollowing things out and we're making it tighter, for sure tighter, right? But tighter doesn't necessarily mean younger. And that's what happened when I was looking at these pictures of before and afters. Yes, I had someone with eye bags. I took out the eye bag. They didn't have the bag, but they didn't necessarily look younger. They just didn't have the bag. Um, so their facelifts, when you would do it, they didn't look as youthful as we were hoping that they would look. Right, 5, 10 years down the line, the skin was getting thin and crepey, and it wasn't holding up so much. And when I started comparing that to what I was doing with my stem cells, well, I was getting much better results long term because we were undoing the changes of aging. And all the stem cells were doing was restoring the collagen, the elastin, the fat, the blood vessels, the collagen matrix, the scaffolding, and the elasticity of the skin. So in 10 years, they looked even better than they did before versus the ones that I was cutting, they needed more work to get their skin to look younger.
So it's kind of like you're giving their skin or their body, like you said, what it needs so that it can kind of fix itself. Is that what you're saying? Okay.
These cells are renewing us. These cells are repairing damaged tissue. So if we have enough cells, enough stem cells that replace all the damaged cells or the cells that need to be replaced, and we're keep renewing ourselves at the same rate that is being destroyed, we will never age. But what happens is over time, our tissues are aging faster than we're able to renew them. So you see signs of aging.
So for people that are listening, can you kind of explain, what is a stem cell? Because there's lots of things out there. Like, I guess we need to start with what is a stem cell, and then let's talk about the different types of stem cells, maybe, so that people understand.
So stem cells are the cells that are genetically programmed to repair and renew tissues. They have a homing mechanism that when there's something goes wrong or you get a damage or you get an injury, those stem cells come there and they start to heal the tissue and they become that type of a tissue. So if you injure your muscle, the stem cells will go there and they'll become muscle cells. If you injure your fat, they'll become fat cells. If you injure your bone, they'll become bone cells. And every tissue has its own kind of stem cells. What happens in the original thought process that we had was embryonic stem cells. Embryonic stem cells has the potential for life, right? So there's a sperm and egg come together, they create this morula, which is what we call embryonic stem cells, and that has the potential to become a whole human being. And anytime people have tried to use that to treat injuries, what happens is those cells are not differentiated enough. They're not matured enough to know what we want them to do. So they will start to try to create all sorts of things in the tissue, and you get tumors, and we don't want those things. So, besides the ethical issues, we don't have practical ways of using those in a very easy way. Then we learned that there was adult stem cells, cells that are found in all the tissues. So you have mesenchymal cells, you have pre-adipocytes, you have all sorts of cells, and you have it in your bone marrow, you have it in your fat, you have it in all your tissues. The bone marrow is the one that we have the most amount of experience with because of bone marrow transplantation. That's 50 years of experience of taking bone marrow and giving it from one person to another. After getting radiation for the cancer, they give them bone marrow. So those are not autologous. That means they're not their own cells. They're taken from one person and giving it to another, and that's why you always have to worry about rejection. But what we're doing is we're using your own cells from your own body. So there's no risk for rejection. There's no risk for your body not knowing what these cells are and what to do with them. And the most used stem cells are either from fat or from bone marrow when we're doing autologous treatments. Now, those are done in the clinic. Now, there's newer options coming, and more people who don't have the ability to do the surgery can buy these stem cells from placenta, from cord blood, from other people. Usually, is either embryonic derived, so it's not from the embryo itself, but it's from the placenta. Is the sort of the sac that the baby grows in, and those cells are very much like the cells that are found in your tissues. Does that make sense?
That makes sense. So you're saying, the embryonic ones, the ones that you can get from cord blood or placentas, things like that. The problem with some of those cells is that if you use them, if you like inject them into somebody's face or their tissue, they could potentially grow something you don't want because of.
I didn't explain it right. So embryonic becomes human. That has a potential of becoming human. We don't really use that. So we have other cells. They're adult cells. These adult cells are found in cord blood, placenta, and in your own tissues, in your bone marrow or in your fat. Um, the cord blood and the placental tissues that are being injected into most people are not their own. They're somebody else's that they buy and they inject it. So they're not autologous. So you can have an immune reaction at times to these cells because they're not your own.
Are these like what people say, like exosomes? If you're going somewhere and you're getting like exosomes or something like that, that's what people are referring to.
Exosomes are packaged signals that the cells produce to communicate with one another. So the exosomes are created in a laboratory. They're not actually cells. The cells are producing exosomes. So you can either inject the cell itself, which we call cellular therapy, or we call acellular therapy, the treatments that we don't use the cell themselves, but we use this language of the cell. And the language of the cell is what makes all the um, what gives the directions to your body what to do. So exosomes, secretomes, consortial factors, these are the signals that the cells are producing. So you can either use the signals which are universal and everybody can use them and you don't have to worry about rejection, or you can use the cells. So if you have the cells from your own body, you don't have to worry about rejection. But if you're using it from a cord blood or from a placenta, they're not your own, and there could be other issues with them.
So my thought is if you're using exosomes, which are the way cells communicate with each other, the problem with that may be if you're giving it to somebody who's really sick or has a lot of inflammation or doesn't have like that structure in place for the communication to happen between, they may not work as well. Is that right?
That is a very, very important point, and I love the fact that you brought that up because cells react to their environment. Stem cells react to their environment. So the way we grow the cells makes a huge difference in what language they're producing, in what secretomes or exosomes they're producing. They can be inflammatory, pro-inflammatory, or anti-inflammatory, depending on how we grow them. Actually, I spent 10 years in my laboratory researching this, and we discovered the language of stem cells. And we discovered how we can mentor these cells so that we can get the same language every time we grow them. And we actually patented this process where we can take any cell, not just human cells, but even plant cells and other cells that use the same language, because the language of cell communication is universal. Everybody uses the same language. They have different dialects, but they all understand one another. So if you're taking exosomes, which is a very small portion of this huge communication, you have to process um, this communication. You have to get rid of everything else and just collect the exosomes. So in that processing, you're actually getting rid of a lot of vital information that the cells need to understand what you want it to do. So the way I do it is that I take the whole language, I take what we call the consortia factors, the consortium or the complete collection of these language, of this direction, where we know what those are because we've tested it in the laboratory and we can reproduce it. So one time you can get a product that says grow hair. One time you can get a product that says get rid of the wrinkles or get rid of inflammation and pain. But with the exosomes, we don't have the capability to do that because the exosomes are processed and they're done in a way that every batch you get is different than the other. So the exosome treatments have a long way to go before we can get to the point where we are with the consortia factors.
Okay. So we're getting like a very small amount of the actual English language with exosomes. But you're saying if you get an autologous stem cell, which is what you do, you can get cells from someone's bone marrow or someone's fat, and you can harvest these, and then you have a way of, do you make them grow more? Like, how do you, well, okay, let me ask you this first before we go there. Are the stem cells that you use from fat when you do your procedures, are those just as good as stem cells from bone marrow?
They're better. I tell you, they're what better. The bone marrow stem cells, we sort of lose that number over time. By the time you're 20 or 30, you've lost like 50% of those stem cells. The number when you're young in the bone marrow is very high. And as we age, it gets less and less. In the fat, the there's 500 times more stem cells in the fat than the bone marrow. So we don't need to grow them in the laboratory if we get it from the fat because there's so many of them that we just concentrate it and inject it back into the tissues and they do the work for us. When you're injecting stem cells into the tissues, they will produce the language because they will start to communicate with our surroundings. So I don't need to do any of that. That's already being done in the body. But if we don't want to use your own stem cells, let's say you just have some uh, inflammation in your body that you want to reduce, you don't necessarily need to do stem cells now. You can take the stem cell language that we've created, those consortial factors, and use that topically without even injecting it onto the skin, and your joint pain or your inflammation in the skin will dissipate. So there's two different things. One is using just the language, and one is using the cells to do the entire healing process.
So if the ones in your, so this is the only time I guess that all women are like, ooh, I love my fat, right? So it's good to have fat because you have these 100 or 500 times more stem cells in your fat than in your bone marrow. So you're getting these cells out of somebody's fat and you're using them for both. You're using them for the language and for the actual healing ability. Is there any way in the future that we could use stem cells from fat instead of doing bone marrow biopsies on people, do you think, to like help people with chemo radiation, like stem cell transplants, after um, issues like this, like disease processes? Would that ever be an option?
So yes, because you can program cells to do whatever we want. There's iPS cells, but every tissue is sort of specialized. So your cells in the bone marrow to are programmed to make blood cells, right? So they're in the bone marrow, and all your red blood cells, the white blood cells are made in the bone marrow, and those are made by those stem cells. In the tissue, in the fat, they're there to heal bone, muscle, nerve endings, your fat, your skin. So they're not programmed to become blood per se. Can we program them to become blood? Yes, but we don't really need to do that.
That makes sense. So it's kind of like a specialist in medicine. Like the ones in your stem or the ones in your bone marrow are really, kind of like a hematology oncologist. They're just focused on blood. But then when you go to the fat, it's more of, just skin. So more like a dermatologist or a plastic surgeon. That makes sense. So then you said something about mesenchymal stem cells, and that's kind of, I interviewed Dr. Khan. I don't know if you know Dr. Khan, but he's a big mesenchymal stem cell guy, does some procedures in Mexico and Dubai. And that's his big thing is like mesenchymal stem cells are the wave of the future. They're amazing. What is the difference between a mesenchymal stem cell and what you're doing with fat cells? Can you explain that?
Sure. Mesenchymal stem cells are one type of stem cell. So in order to get only mesenchymal stem cells, you have to grow it in the lab. And when you grow the stem cells in the lab, right now, for the most part, you're only able to grow one type of cell. So most people who grow cells in the laboratory, they're growing mesenchymal stem cells, and then they're what we call expanding those cells and then injecting it back into the patients. Because the fat has so much stem cells, I don't really need to grow the fat cells to do it. And the other thing that it gives you the entire sort of spectrum of stem cells: pre-adipocytes, endocytes, endothelial cells, mesenchymal cells, V cells. All those things are in the milieu of the tissue. So when you're getting everything and you're giving back everything, they all are working together synergistically. And we've seen when we use mesenchymal stem cells by itself, we don't get as a good of a result than if we do SVF, which is when you enzymatically remove all the fat and just get the collection of the stem cells. And when we don't do that, even, and when I don't do enzymatic and I just get the mechanical separation, so we keep everything intact, we even get better results. So the cells are like soldiers. The stem cells are like soldiers that need direction, and they need sort of hierarchy and communication between the cells. So the more of those communications we have, the better the result is in the tissue. So you get better and faster results.
And that makes sense. So you're saying when you take fat, so in the procedures that you do for your cosmetic stuff, you're going to go and extract fat from someone and then you're going to place that fat with all the messenger, all the stem cells, all the language back in somewhere that you want the body to utilize that. So you're actually using their fat with their own stem cells and just kind of putting it in a different place. It's almost like a fat transfer.
Absolutely. So for the cosmetic part, right, when we're not talking about medical stuff now, we're just talking about cosmetic. For the cosmetic part, you need some fat to restore volume because as we age, we lose volume, everything sort of shrinks. We need to restore the volume and the proportions so you have that youthful look to you. And the stem cells, when you increase the ratio of the stem cells to the fat, you're going to get all the regenerative effect of the stem cells. If you're using it for, let's say, joints or for autoimmune disease, then you don't necessarily need so much fat. You need more of the stem cells. And the process that I've created, the stem cell lift technique, allows me to sort of play with the concentration and the proportions. So for cosmetic, I can use more fat, and for the autoimmune disease, I don't need so much fat.
So you can actually take the fat out of what you extract and then you could actually put it directly into a joint or directly into a space to kind of help that area, I guess, heal and not be so inflamed.
Right. So, like, if you get a knee injury and you've torn your cartilage, the meniscus, the only thing that will heal that cartilage are stem cells. There's nothing else that will heal it. It won't heal by itself. There's not enough cells, there's not enough signals, there's not enough blood flow there for it to heal. But once you inject the stem cells into the joint, it has a homing mechanism. It notices where the damage is, it goes in there, and it becomes part of that tissue and then starts becoming like cartilage. And it will heal the cartilage that's torn.
So why don't more people do this? You know what I mean? Like, is it be? I mean, I'm just sitting here thinking, like, man, I bet this will piss off a lot of orthopedic surgeons. But I mean, to me, it makes sense, right? Like, why would you not inject things like this into joints as opposed to doing surgery? Because to your point, if you're doing surgery and you're cutting into someone, you're cutting through their skin and their fascia, and their tendons and repairing these things, I mean, you're creating so much inflammation, right? So like, have you ever used these and injected them into joints, or you stick with the cosmetic stuff? Or does somebody take these from you and inject them into joints? Like, why aren't people doing this?
I do a lot of joints. I do a lot of joints, and I've saved a lot of people from having to do knee replacements, for shoulder replacements. I've done it for autoimmune disease, for rheumatoid arthritis. We inject their hands and their pain goes away. Um, I mean, this is something that is actually, when I started doing this, I had to go and explain to doctors what stem cells are. Today, when we go to conferences, we're talking about what kind of stem cells. So things are moving. The medical world is a very conservative world, and they need a lot of um, data and a lot of studies to show them that these are the things to do. And when you don't have pharmaceutical companies funding all these things, it's a very slow process because you have regulatory issues and you have funding issues. But in the clinic, more and more people are using stem cells to do joint treatments, to do autoimmune disease, to do cosmetic treatments. And I've done a lot of post-cancer reconstruction using these stem cells. It's just there. Think about it. Anytime you get injured, stem cells are your solution because their job is to repair and renew.
So when you say post-cancer reconstruction, are you talking about like breast? Are you talking about skin cancer? Like, what are you talking about?
Both. So you have, if you have a breast that was a lumpectomy, so you have some tissue, then the stem cells will know what to do. You can inject it in that area and restore the cosmetic look and the feel of the breast without having to put implants and do a lot of big surgeries.
Yeah, that's what I was thinking. So instead of doing, because I actually interviewed Dr. Whitfield, which is the breast implant illness expert, on this podcast, and he was talking about all the issues that people with autoimmune disease get with breast implants, and so that was my next thought: is like, is there going to be this wave of plastic surgeons that get fat and just transfer it somewhere else, and you get breast augmentation that way? I mean, that makes more sense, right?
Yeah, I mean, we've been doing fat grafting to the breast for many years. When you add the stem cells, the take is a lot better, the results are a lot better. Um, the technique is very important how you do it so that you don't get calcifications and other issues with it. Um, but I think that's a huge plus for people with autoimmune. Their limiting factor is how much fat do they have, right? Because in order to get 1 cup size improvement in your breast, you need a good amount of fat to do that. So you need it's more of a liposuction sort of movement than a just a little bit of fat for joint or for the face.
Like, how much fat are you talking for 1 cup size?
You need minimum of 250 cc's per breast. So that's about, a good.
Soda can, right? Like a 12-ounce soda can. So you have to get that much fat out of tissue. So like, how much weight do you think that is in pounds of fat? Any idea?
Fat doesn't weigh a whole lot of, it doesn't weigh a whole lot. It has water with it. Maybe if you take out that, maybe 2 pounds of fat, it's not much fat.
So when you go to take out fat for joint injections and, cosmetic procedures, how much are you getting? You don't need a whole lot.
No, very little. 20 cc's, 50 cc's, depending on how many joints and how many places.
So I want to talk about autoimmune stuff and then I want to go back to cosmetics. But you said this several times, and my brain is like, I take care of all these women with autoimmune issues. So Hashimoto's, I take care of so many people with PCOS and just issues like that. And so are you saying, would there ever be a time or a way that we could do these injections into thyroid glands or into ovaries or into places where, people have a lot of inflammation and issues? Like, do you foresee that would be a treatment option ever for people?
So for ovaries, they're already doing some PRP and other treatments to stimulate the ovaries so that they can recover, sort of, if they have PCOS or if they have problems getting ovulation and getting good eggs coming. that has shown to help women ovulate better and get better cells produced so they can get pregnant. So things like that are already happening. They are not widely used. The whole process is still very sort of in its infancy, but people are starting to do it. A lot of people use stem cells as an injection into the vein for autoimmune or for a lot of diseases that we have a hard time being able to inject it directly into those tissues. And you do get some improvement for a short time, but we don't have studies that show long-term improvement in most of these cases. So, and I think the reason is because we're taking this concentrated number of cells and then diluting into the bloodstream, and only a few cells end up where the problem is, and they will improve the tissue so much, and then you got to repeat those sort of injections.
Yeah, that's what I tell my patients. If they ever are looking at doing like IV therapy, exosomes, things like that, I say, well, if we're going to do that, we at least have to start cleaning up the environment first, right? Like it's kind of like it doesn't matter if you're eating all the organic food that there is, if you're not sleeping and you're not exercising and you're not, doing a sauna, you're not doing basic things. So, like, I think a lot of the problem with some of these people that are out there, a lot of doctors, a lot of different people do whatever different therapy, if you're just giving someone exosomes or giving someone a stem cell product, but you're not talking to them about, the fact that their inflammatory markers are through the roof and they have Hashis and they're eating terrible and they're not exercising and they're not sleeping. I mean, you're just wasting their money, right? Because they're so inflamed, those cells probably go, well, where do I start? Like they're overwhelmed, like everyone is when they open their phone and get on social media, right? Like, so you have to kind of start with some basic health, advice and tips no matter what you do.
That's a very good point you bring up because I treat a lot of women with lichen sclerosis. It's an autoimmune disease that destroys the genitalia of women, and it's a miserable disease. And um, a lot of that disease is driven by hormones. And what most doctors miss is they don't realize that you need to balance those hormones so that the treatments that we do are going to be optimized so that the long-term effects are going to be there, and they're going to be sort of in a balance where the body's in balance, the tissue is in balance, and then now whatever results that we can get from doing these stem cells, you're gonna end up having them for the long term. And I think Hashimoto's and are very much connected to these kind of diseases because once you have one autoimmune disease, you have more prone to having other ones, and your immune system is responding to the tissue. I think a lot of people think the problem is the immune system, and I don't think that. I think the problem is the tissue. The tissue is giving a signal to your immune system that there's something that doesn't belong there. The immune system is functioning properly, saying, okay, you don't belong here, I'm going to attack you. Now we're going to get this inflammatory response because that's what the immune system is going to do. So if we were to reduce inflammation and get the signals away, which we don't really know how to do right now, but if we can figure that out, then we won't have the disease. And what stem cells have done is exactly that in my lichen sclerosis patients. I didn't realize what I was going to be able to do with the stem cells when I started treating these patients. I thought we were just going to give them some relief. And I've treated like almost 400 patients with lichen sclerosis, and a third of them are in remission. They don't have the disease anymore. They don't have that signal from their tissues going saying I don't belong here, and the immune system is attacking. They're not, that has been corrected by the stem cells. So we know that stem cells have the ability to stop um, the immune system from attacking the body itself. And I think the reason it's doing it because it's correcting that signal that's on the cell. So it's healing whatever the missed signal is. It's correcting and it's healing the tissues.
That's amazing. I love that. And to your point, yes, if you have lichen sclerosis, because I have a few patients with this, now I know what to do with them. But you have to fix their estrogen. You can't not give someone estrogen and expect their vagina to heal itself. Like that is not going to happen. And so to your point, like, yes, you have to find somebody who understands physiology and understands how everything works together. But that makes sense, right? I have people who come to me who've had this disease for 10 years and, can't have sexual, can't have sex with their partners. It's so painful. A lot of them have issues even going to the bathroom. And it's like they've never been put on estrogen. Like this is like 101, right? Like how do we wake up the vaginal tissue? We give it estrogen. And so, yeah, I mean, you have to do that. But then this sounds amazing to your point because I kind of agree with that. I feel like autoimmune processes are your body attacking cells because it thinks something is not supposed to be there or something's wrong. Or, to me, autoimmune disease has always been very interesting because although when you get one disease, you're more likely to get others. I tell people this all the time. Like, you can have terrible Hashimoto's, but your blood pressure is fine and you don't have diabetes and you don't, I mean, so it's not like your entire body has like misfired and like your entire immune system is off. It's doing probably what it thinks it's supposed to do, right? Or what it's programmed to do, which is attack your thyroid gland or attack, the skin on your vagina or whatever it, attack the joint in your hand or, over your face and give you a malar rash if you have lupus, like, or your kidney. It's doing what it thinks is right. And so to your point, we just have to figure out how to make that signal stop. And if stem cells will help I mean, that makes sense that it works and that it would be fascinating, assuming that the patient is also doing their part, right? Like you can't be lathering yourself in terrible chemicals, drinking excessive amounts of alcohol, not sleeping, things like that. You have to help your body, but that makes a lot of sense when you say that. So have you ever used this with Hashimoto's patients?
So I've used stem cells for all sorts of things. I don't generally inject into the bloodstream because it doesn't really long term doesn't help. But I've seen patients who've used these treatments improve their Hashimoto's as well because, like you said, the whole body is inflamed. So I also have other biohacking treatments that I do in my clinic that help reduce the inflammation in your body, and then your body is able to sort of overcome things and you can heal yourself.
So here's what I'm wondering. So I do thyroid biopsies in my clinic, right? I have an ultrasound, I do biopsies, fellowship trained to do that. Could we take a needle into their thyroid? Because whenever I look at a thyroid, it is, I can tell you if you have Hashimoto's by looking at your thyroid. I can tell you which side is worse. I mean, I'm very good with an ultrasound. Could we just inject these stem cells just like I'm doing a biopsy right into a thyroid with a, 23 gauge needle and make their thyroid better? I mean, I don't know. This is just a question.
I think we can, and I think people who will do that will see improvement in their thyroid. Yes, you just have to worry. The risk of putting it in there is getting thyroiditis from the actual treatment, right?
I'm telling you, yeah, I've done thousands of biopsies. If you do it correctly, I mean, your risk of thyroiditis, assuming they're not, I check thyroid labs.
No, I'm saying the cells themselves may cause inflammation because they're going to set off a healing process.
Yeah, but they're already inflamed. So like, they're already inflamed. Like, I mean, these people, I have people that have just massive thyroid, 7, 8 centimeters for half of their thyroid. I mean, it is wild. So in these people, I'm very curious. Like, I think that would be so cool. I know there's research in Europe where they do iodine ablations and things like that. But to me, that seems like a no brainer, right? Like, you can put the needle right where they're most inflamed too, right in the middle and give them cells, or you could even target it to, I mean, you could do multiple injections. They're not, it sounds worse than it is. I do thyroid biopsies in my office all the time. We don't numb you. We don't, I mean, you just put a cold pack on there, spray them, and you're in and out before they even know. It's pretty quick.
It will definitely improve them. And I have a colleague who's in China, and we talk all the time about what he can do, and we are very limited in the United States with all the regulatory stuff. But what he can do is he'll take the cells and inject it into the pancreas. So he'll heal them and they start producing insulin, right? He will do it to their liver, and their liver will get improved, and the fatty liver will get improved. So to do it to the thyroid is a no-brainer.
Can we do that legally? So I know that, like, you can't do mesenchymal stem cells in the United States, right? That's why Dr. Khan does it in. Can we do that here or not?
You can't manipulate the cells. You can't grow them. So if you're expanding them and want to inject it back to from one patient to another, you cannot do that. If it's your own, some people are banking and injecting. So that there was a whole lawsuit with the FDA about this. So there's things that you do.
I would have to find someone who could harvest them, and so basically I need to have a clinic in Beverly Hills next to you, and we can just inject people's thyroids and we
You can
can
do it in
do
my
it.
clinic.
No, I'm serious. I have so many patients. I'm thinking
I'm
like this would
serious.
be so beneficial. I like me 10 years ago, this would have been so beneficial, right? Like I had terrible Hashimoto's and like thankfully now I don't, but I had like this big fat goiter on my neck. And yeah, I mean, it's so easy. It is so easy. Like literally would take 2 minutes for me to do and takes a 22, 23 gauge needle. I mean, cheap. Like I need a 80-cent needle and a syringe, and then I need your expertise of getting the cells. And I mean, easy, right? Like it's crazy. So okay, now my mind is just,
That's good. So come do it. I love
yeah,
it.
we should do it. That's all we need is an ultrasound. Okay, so I want to go back and
I
talk to you
have
though
the
about,
ultrasound.
yeah. I have one too, but we can use yours. Um, I want to go back and talk about though, like how I met you. And so for listeners, if you're listening to this podcast, so we're recording this podcast in February. I'm actually going to go have a procedure with Dr. Newman in 3 days. I'm so excited. When this comes out, I will already have had it. And I will make sure that you guys can see all the images before and after and everything. I met him through my good friend McCall McPherson. And I want you guys to understand what he does because it's amazing. So I want him to talk about his stem cell facelifts because I feel like there are so many people who, especially with autoimmune diseases, get filler and get cut on and get all these procedures and then are so upset after the fact. And nobody really talks about that. But I see these people, I love my patients so much. I love everything about them. And they tell me about these things. And so, like, I get to see people who do the filler or do the procedures that somebody talked them into, and then they're very unhappy. And so, what I wanted Dr. Newman to really talk to you guys about before I derailed him on the Hashimoto's was I wanted him to explain to you what he does with stem cells for facelifts. I want him to kind of explain to you the procedures that he does. He can explain what he's going to do to my face, which is my under eyes. I'm just somebody who genetically, he says genetically, I'm going to go with it, have really dark, like sunken in under eyes. My mom had it as well. And I'm somebody who I don't want filler. I've had multiple consultations and people have said, oh, let me put PRP or let me put filler. I'm just terrified that with my autoimmune disease, I've seen people wear it migrates and it just looks bad. And so I was just under the impression I was going to have dark eyes. And some of my patients have said this to me, like, you look tired, Dr. Smith. I'm like, no, that's just my eyes. But Dr. Newman's going to fix that for me. So he's going to explain to you what he does with this stem cell facelift, kind of the procedure, what it's about, why it's better than doing it with filler, and what you can do as far as a facelift without even cutting anyone. So can we start with that? And then we're going to talk about your amazing skincare stuff.
Sure. I'm going to start with what happens with aging. I think because one of the things that we need to understand is aging is a process that you're losing the proportions, the useful proportions in the face, and you're hollowing out, your fat is reducing in size, and the skin sort of comes down and sort of droops over here where it in the folds. And most people then think about, okay, I need a lift, I need to put it back and start pulling everything back. The problem with that is that you're pulling back this skin that's fallen, but you're not restoring the volume. So I give the analogy of, you know, the grape that's become a raisin. If I take it and pull the raisin, yes, it's smooth, but it's not a grape anymore, right? But if I take the stem cells and I inject it back into the raisin, it will start the whole process of renewing that raisin to build back the grape. So it will give the volume. It will improve the skin of that raisin. Won't be so leathery. It'll start to smooth out and become nice and shiny, like it was when it was a grape. And that's what it happens to your own skin, right? It gets wrinkled and it loses elasticity. So fillers and cutting doesn't restore it. Um, Stem cells do. So we can restore the proportions and we can restore the volume. And if you do that, now I can sculpt the face to anything that I want, either restore you back to the way you were, or if you had asymmetry or genetically, not great proportions, or like the hollowness that you have under your eyes gives you shadow effects, right? It thins out the skin, so you have the Tyndall effect, which is when the light hits the blood vessels over here, you see it darker, right? So those things make you look tired because when most people who don't have that, they look more youthful, right? If we were to inject right here, which we're going to do for you, and you're going to look fantastic, um, you're going to see that those little changes make all the difference. Like when we do a eye lift, right? When we do blepharoplasties, when we do eyelid surgery, the the difference between a great surgery and a terrible surgery is 2 millimeters. We don't have to do big changes. Little changes make all the difference in our faces. So if we can take the stem cells and sculpt the face, you're going to get the improvements, and you're going to get you're going to age backwards. You're going to turn back the clock good 5 to 10 years. Now, people with autoimmune disease, they already have problems with healing. They have inflammatory components that are going on in their body, and those things don't respond very well to fillers, which only can do one part of your face. I mean, if you put filler everywhere, even if you don't have autoimmune, it will not look good and it'll cause you a lot of problems because you're putting so much foreign materials in you. We're talking about if I were to do your face for with the stem cells with 20 cc's, well, I need to have like at least 40 cc's or 50 cc's of filler. That's crazy. Most people use 1 or 2 cc's, 1 or 2 syringes, not 50. So if we put all that foreign materials in there, your body doesn't like it. And it just sits there. It doesn't look good. The stem cells incorporate into your tissues. They become part of you. They will age with you. They will change with you. Fillers don't do that. And fillers cause inflammation. So you're going to get, because most fillers have a lot of sugar in it. So sugar definitely causes inflammation. You get glycation, which is a whole thing that we don't like. It ages the skin. It causes granulomatous tissue. When we do surgery in people who've had fillers, there's a lot of junk that you have to clean up. So in general, if you can do stem cells over filler, it's much better. Um, and then with the stem cell, if you don't need to go into general anesthesia, which is a huge thing for people in general, because 1 out of 200,000 people don't wake up from general anesthesia, even if they're healthy. Now, if you have autoimmune disease, you don't know how your body's going to react to all the chemicals that we're giving you to put you to sleep and to wake you up. So there's more risks, in my mind, for people who have autoimmune disease because we don't really know where the balance is. Um, and I think those are the biggest takeaways when it comes to stem cell versus the fillers. And then you have no scars with the stem cell lift. There's no stitches, there's no scarring. We don't change the proportions of the face in a way that is not natural. We don't change the way the muscles move or the skin moves. So when you animate, when you smile and everything, you look like you, versus when we cut, sometimes it doesn't look so natural.
Yeah. Everyone's seen those people that have had a facelift and like things aren't moving right. And it's just, they may look sort of younger, but it doesn't look right. So,
And the other risk is no bleeding and you don't hit the nerves because we're not cutting. Biggest risk that you have in a facelift is either bleeding or cutting the nerve. And then you get, some people you've seen them on TV, they can't move their face.
yeah. And did I correct me if I'm wrong, but you said if you don't bruise from so basically you just make a little incision wherever you're gonna, or I mean a little like stick, not incision, I'm sorry, a needle stick wherever you're gonna put the filler, or not the filler, the you make a little needle stick wherever you're gonna put the fat instead of the filler. and then you lay the fat in there. But if you don't bruise from that needle stick, then you shouldn't bruise at all. So basically, the next day you look pretty much fine, not a bunch of pain, anything like that. Correct?
Right. The what makes what makes you bruise is my numbing. When I go in there to numb it, is that I use a sharp needle. So if I don't bruise you when I numb you, you have no bruising.
So the pressure's on, guys. I'm going to show you guys post out day one. If Dr. Newman, no, no, I'm just kidding. But still, even a little bruise with that is way better than cutting and all the things. So then, if you're doing an entire facelift on somebody, how many like sticks are they going to have? Like, and you know what I mean? Like, how long? And how long does this take to look better? Because I'm assuming I'm not going to wake up on Friday and automatically look better, or am I? I'm going to automatically look better on Friday.
You're gonna look better, but you're gonna be swollen. So the swelling is what the biggest downtime somebody has is how much swelling they have. So the swelling is usually about 2 weeks. And then the stem cells really start to show the improvement of the skin about 6 weeks. So you're going to get that glow in your skin about 6 weeks. And the cells themselves incorporate into the tissues and become part of your skin permanently at about 3 months. So whatever you get at 3 months is yours for life.
Okay. And so when you do the facelift, how many different places are you like? Does it depend on the person or is there?
It depends on the person, but in general, I as little as 4 needle sticks to 6 to 8, depending on how many areas we need to get to.
But you can have a pretty dramatic difference. And we'll link all of Dr. Newman's stuff, but you can go to his website because I looked at some of the pictures and it was fascinating what you can get without cutting and pulling. And so that, I mean, I just want people to be aware of this. Can you use this product and do like micro needling? Would that be beneficial to help like, the texture of your skin or the, like, the discoloration, or would you just recommend using your skincare products for that?
So the skin itself, I use the products that we've created from plant stem cells using our patented technology that we talked about. So those products really help to reduce inflammation and improve the collagen and sort of undo the aging process. We call it regenerative serum because it's really regenerating your tissues. So I use that for the long term. For during the procedure, some people have more laxity. You don't have any of that, but if your skin is more sun damaged, you have more laxity. So I do use other modalities to help improve the skin. So we can do microneedling with radio frequency. We can use our exosome and consortial factor products to do it topically on top of it to stimulate the skin because those stem cells that we're injecting, they're looking for signals, right? So if I do microneedling on the skin, they're going to see the sort of little micro bruises, micro punctures, and they're going to say, "We're going to go and fix this," right? So they're going to sort of go more towards that. There's the signals are giving to the cells, come and heal, and you're going to get a more robust improvement of the skin. So we do that a lot, combining different modalities.
So you can do that. Okay. So then so Stim, your product that you made, your skincare product, which I have been blessed to have tried it for almost a month now, I think. So the face wash and the lotion, all of it. Tell everyone about that product. I just want to kind of know like how you invented it, why you invented it, what it does. So let's start with that.
So when I started looking at what happens in the clinic, we saw the changes in the skin, and it was very quick. So I knew that it was something the cells were producing. I opened up my lab, we started researching stem cells, and we came up with a way to sort of mentor the cells, to guide the cells, to to give us the specific language for what we want. And that patented process really has changed everything I think about how we approach skincare and how we're going to in the future use stem cell therapy therapy for medical care because we can use it for burns, we can use it for a lot of applications without having to use the cell. Once you apply the regenerative serum on the skin, you're going to see the changes within a month. You're going to see changes in your skin. The regenerative serum has about 90% of the product is stem cell derived factors. So these are very potent products that you can't get anywhere else. This is sort of a very unique idea. And we do the whole process from the cell to the bottle in our lab. So I control everything because we had to develop everything. None of this existed. So we had to develop ways to grow the plant cells to get them to give us the sort of directions, and then bottle that in a way that it will stay consistent over and over again. So that's what we have with the stem products, and the stem products are great to not just for the face but for your entire body. We have products, and I think it will replace a lot of the anti-aging products that we had. This works with your body, not at your body. Before, we had, let's say, retin A, we had vitamin C, hyaluronic acid, and you had to buy all these different products and then put them on, and you spend hundreds of dollars trying to get something that would tell your skin to do one thing. Here we have a product that has the whole set of directions that gives your body the ability to do it yourself. So I don't need to give you vitamin C for anti-aging to say take away the inflammation or to renew the skin or to lighten the skin. All those signals are already in the product, and when you put it on your skin, your body understands what it needs to do and it will do it. It's called the paracrine loop effect. So it's like a domino effect. You give a signal and then there's a dialogue between all the cells. So this dialogue, this sort of paracrine effect, doesn't exist when you're doing anti-aging signaling with one signal, because the body uses many pathways. So you got to address the whole thing versus just one word. One word doesn't mean anything to the skin over the long time, because at one point or another, your body says, "Okay, make collagen, make collagen, make collagen." I made collagen. Now what? Your body gives you a negative response after a while because it it knows to listen for a certain time, and then it says, "Okay, maybe this signal is not enough. Is not the right signal anymore," and it shifts.
So so it's just going to work with your body and your skin to make your skin kind of heal itself and do everything it needs with less amount of products. This is what I heard. So, I've had people who ask me all the time, like, what is your skin routine? And I'll show people. And it's a lot. Like, it was a lot, because it's like, yes, to your point, like, oh, you need a wash, and then you need, a lytic treatment, and then you need a serum, and you need something with vitamin C, and you need something, a toner, and you need something for, melanocytes, and oh, you've got to have something for reds, and then you need your lotion, and then you need your your sunscreen. And so it's a lot. So with your products, we don't need as many. Is that correct?
Yeah, because the products work synergistically and they replace a lot of the products that were meant to do one thing. So here in one product, we're doing many things. We're increasing your own hyaluronic acid in your system. We're increasing your own collagen. We're increasing your own elasticity. We're improving the whole tissue and giving back the glow and youthful, healthy look naturally. And that product will continue to work with you because your body will take what it needs from it. This entire set of directions are there. So when you need more of one thing, it will take it. And when you need less of that, it will take something else that's in there. Because all those exosomes that you talked about, all the peptides that people are using, which are mostly synthetic, all of those things are naturally found in these products. So you have the vitamins, the peptides, and metabolites, the exosomes, all in this one product where your body knows how to understand the directions that we're giving it, take what it needs at the time that it needs it. So if it's inflamed, it will reduce the inflammation and then goes to the reparative phase. So it goes then to build collagen. And once it's got enough collagen, it goes to say, okay, I need a little bit more of the blood vessels. And it'll just keep doing that.
Yeah, and what I have found, like I said, I haven't used a ton of time yet, but what I found is like my skin is so dry this time of year, and the night cream, like when I put it on, it's like I don't know, it's like heavenly. And my skin has not been as dry. And then even I used some of it, like I was putting it on my face. I rub it on the top of my hand because my hands are super dry too. And I was even getting this like weird little rash, and they've been so much better since I've just been using the night cream. So what is your favorite, like, so if you go to your website, and we'll link his website so that you can look at these products, but if somebody goes to your website, what is maybe your number one or like top two picks that somebody should try if they're like overwhelmed and they don't want to, try everything at first? What would be like their biggest bang for their buck?
The biggest bang is going to be the serum because that's the one that has the most amount of the factors in there. So the regenerative serum is the the first thing that should go on clean skin. So you wash your face. The wash I have doesn't strip off the oils and it doesn't dry out the skin. It doesn't destroy the microbiome that's healthy on your skin. So so that's important. The wash you choose, if it's ours or if it's somebody else's, that it doesn't destroy it. But the serum should be the first thing that goes on, and then the next thing you need is to seal it in and to moisturize the skin because this is not necessarily just a moisturizer, so you need a moisturizer to seal it in. And if you are dry, then the night cream definitely is going to help to seal it in and give you that moisture and benefit the skin. So those two are probably the first two things I give people to start with. And then the day cream does a lot of other things. They all work synergistically, but is not as heavy. So when you go and put the day cream, then you put makeup and other sunscreen, it doesn't feel so heavy on your skin, and it doesn't break you out. All of these are water based, so you're not going to break out from it. And and I would love to get the feedback from people when they use it.
Yeah. No, I've loved it so far. My other question for you is, can men use this? Cause my husband, God love him. He, anytime I get something, I want to try it. So he's actually trying to steal all my stuff that you sent me. But I was like, maybe he has his own men line. I'm trying to get him to like leave my stuff alone. Do you have your own men line of stuff, or is just all like anyone can use it?
So the stem cell factors are universal. So we don't need a men and women's line for the basics. Uh, for later on, there are things that we're going to bring that are specifically for women or for men, but for your routine, daily routine, this is for both men and women, and you can use it from any age because the whole idea is to maintain the healthy skin. So it's not just about getting rid of wrinkles or anti-aging. This is maintaining youthful, healthy skin.
Yeah. And I've really liked your face wash too. It's for listeners, it's like fluffy. It's not like liquidy. It's like you pump it and it's foamy. That's the word I'm looking for, foamy. And I do feel like it hasn't, like, I was used to using like sort of like a lytic type wash because I'm more prone to getting acne, but it will dry your skin out. And this one hasn't. And I haven't had more acne either, which has been great. So I've loved using it so far. And then I think, for our listeners, if you guys are interested, we will definitely put all of the information in the show notes. And Dr. Newman has been nice enough to give you guys a discount code. So we'll put that there. But I think it's just going to be Dr. Cassie 10. And he's going to give you guys 10% off whatever you want to try. And to his point, like maybe just try, if you're overwhelmed, the serum and the night cream to start with. But, a face wash, a serum, and a cream, that's pretty basic. Like your skincare routine doesn't get much more basic than that. That's like 3 things. Mine was like 11. So, and then you need a sunscreen. But I'm super excited to, be able to use it. And I'll definitely make sure that you get feedback too. And then we'll do our before and after pictures. But I've noticed a lot already. So I've been enjoying using it. Thank you so much for chatting with us, you guys. I really think that Dr. Newman is like, the goat of stem cell therapy, especially with dermatology and, the things he's doing with facelifts and, helping people fix things that they may not like about their skincare with his procedures that don't require cutting and don't require fillers and are very, sensitive to people with autoimmune issues, I think is wonderful. And so I'm so happy to have met him, and I'm so excited about my procedure that I'm going to have in a few days. At the end of every podcast, I ask my guests 3 questions. And so don't overthink this. This is super easy, but people love this. So if I don't ask you, I'll be in trouble. What is one food that's most beneficial and why?
Water, because most people are dehydrated. And I think most people, as we get older, that causes the most amount of health problems because they're just dehydrated.
Yeah, I would agree. Water. Most people are very dehydrated in general. Like they have no idea how dehydrated they truly are. And for those of you listening, if you drink tea and soda and coffee, that does not count as your water consumption. So I have people who ask me that all the time. That does not count as your water consumption. What is one thing that anyone can do that will better their health that's 100% free?
Walking every day. You walk every day, half hour, you're going to be healthy. They've done so many studies on this. So simple. Just walk. Be physically active.
Yep. And go outside if you can. And that's even better if you do it in the sun. And then what is one thing you wish you would have known about your health 20 years ago that you would have done differently since you know everything that you do today?
Oh, that's hard. Because becoming a doctor, you don't sleep a whole lot. I think sleep is a huge thing. And I don't know how I would have done it differently, because when you're, in the hospital, you don't get to sleep a whole lot. But I think I would have slept more, or tried to have more regular times of sleep for my diurnal rhythms.
Yep. I think that's my biggest one too, is sleep. Unfortunately, traditional medicine is not very conducive to being nice to you or teaching you to treat yourself nicely, which is, I think, a lot of the issue with traditional medicine today, right? Is doctors don't know how to tell people to heal themselves because we're not taught that in school. And sleep, nutrition, movement, water, sunlight, these are all very just basic things that we completely miss in medicine. So I think those were all perfect answers. No one's ever actually said water, but a lot of people say walking and sleep. So thank you so much for your time today. I really appreciate it. I know our listeners will appreciate it. I know people have been super excited to hear this. And so by the time this airs, you guys, we will have all the before and after pictures. And thank you for joining in to the podcast episode today.
Thank you.
Thank you for joining me on this episode of our podcast. There were so many great takeaways, and I hope that you enjoyed it. Most notably, I hope that you enjoyed learning the difference between the different type of stem cells, and then learning about whether one of these procedures or one of these stem cells could be something that would benefit you in your health journey, or possibly one of your autoimmune disorders. Thank you so much for your time. I know that your time is very valuable, and I appreciate you spending it with us to try to become well or get better. Please make sure that if you enjoyed this, you share this with somebody. I know that this could benefit so many people, and so I need your help in sharing this podcast. Make sure that you leave us a review as well, wherever you get your podcast. I appreciate the reviews. It helps me know that we're doing a good job and that you want us to keep making these podcasts. Please go on social media or anywhere you find or follow me and message me about any sort of topics that you would like for me to talk about in future episodes. I appreciate that feedback as well. Remember that Modern Endocrine is now able to see people in 21 states. A list of those states are listed on our website. We do virtual visits, so you don't have to be in Oklahoma. But if you are in Oklahoma City, we do have a state-of-the-art, beautiful clinic with lots of amazing things like red light therapy, cold plunge therapy, an IV suite, and so much more. We also now have a nutritionist who is able to see people in all 50 states. She's wonderful in helping you get back on track, or just if you need somebody to help you get on track to begin with. And finally, make sure that you join us next week for our next episode of Hormones, Metabolism, and You. Have a great week. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.